So we're back. Melissa and my friend Bianca.
Hello.
Hi. So, we haven't seen you guys in a little while, but we wanted to just put this out there. Bianca was excited to share with me that she went to Yale, New Haven School of Nursing and did a lecture. So, Bianca, let's just quickly just shoot the shit about it.
Yeah.
So,
yeah.
You went there for school.
Yeah.
Tell me what it was like to go back there.
Yeah, it was wonderful. I hadn't been back since 2018 when I graduated. And so, going back there and being able to, work with the students again. I did a 3-hour workshop all about the pelvic floor and pelvic pain and the nervous system and how we can address chronic pain by activating our sympathetic nervous system, our rest and digest part of our nervous system that helps us calm down. And it was just a lot of fun.
There was other nurse practitioners, right? So
yes.
It's the school. So she's totally not prepared for this. I'm just throwing this at her right now. This is like the hot seat, so that's kind of fun. But I don't want to stress you out. I just really want to know, what are the top 3 things that you think really made an impact in your discussion with them? What was the most surprising for them? Maybe what was the most interesting for them to hear? And then what do you think made the biggest difference for them as students, not even out in the world yet, doing what they're going to be doing, and maybe this is the first time they've even heard about pelvic health.
Yeah. So I have to say that the professor there who does their women's health teaching, she's incredible and has already talked to them about pelvic pain. And so they came in, sort of prepared. But I think, what was the first one? What was
what was the most surprising
to them? Yeah. Let's see. I think when we really talked about the importance of down regulating and relaxing the pelvic floor, I think they're trained, especially these were nurse midwife and women's health NP students. And so, when they see postpartum patients, that's really the time that they have learned so far how to assess a pelvic floor and have them do a Kegel. But we really talked about the importance of assessing tone and if someone's pelvic floor is really contracted and how to assess the strength of it, but also how to assess if that person's able to relax their pelvic floor. So I think understanding the importance of that was probably a new and surprising thing for them.
Yeah, I mean, I don't know about you, but I don't even recall if my doctor tested my pelvic floor muscle strength after having kids. So you think about that, maybe you never were tested for your pelvic floor strength. Maybe you don't even know what it is. And that's totally okay. But we want other people to learn that, pelvic floor muscle assessment is part of learning about your pelvic floor, and whether that's at the nurse practitioner level, the GYN level, it's good information for everybody to have. Mm-hmm. What do you think was the biggest, the most impactful? Also, is there anything any other touch points?
Let's think. There was so much. It was a 3-hour workshop.
70 slides.
Yeah, it was a lot of stuff. I think one of the most impactful things is we actually did some nervous system regulation work ourselves and trying to activate our vagus nerves and learning how to, do some deep breathing and connect that to the pelvic floor and ground ourselves in a room and create a sense of safety.
That sounds great.
It was really awesome. And so
it's not all muscle.
No, it's not all muscle, right? Yeah. Our muscles, what we really talked about in that segment of the workshop was, how we experience pain and how our muscles react to pain is very deeply, and connected to our nervous systems. And so, if we can, kind of break a stress pain response cycle, that can be really important for ourselves as healthcare providers because it happens to us, and also for our patients. And so that was, I think, something that they were really able to embody in the workshop.
And I don't think that's taught in school either. I mean, I even as a physical therapist, I don't think I've learned that until many years later.
Same.
Yeah. Mm-hmm. So it's really important to know, there are other ways of managing pain, other than just medication. Mm-hmm.
Or in addition to medication.
Or in addition, right.
Right? That it's, I think that was something that we also talked about is that it really is a puzzle and there are all, pain and stress and all of these things and chronic pain. It's a multi-layered, process about how it happens to our body. And so then when we address it, we need to, really look at it from all of these different directions. And so there's not just going to be usually one magic bullet, but it's really looking at the whole person and all aspects of their health and how we can, treat them.
Right, and you said stress too, so I'm sure that some of these techniques that they learned not only affects the pain, but even can calm down the nervous system. And stress, nervous system stress, they go hand in hand.
Absolutely.
Well, I know I don't want to keep you, I'm putting you in a hot seat really quick, but you did tell me you're going to California.
Yes.
And I am so jealous about this, but go ahead, tell everybody what you're going to be doing.
Okay, I'm super excited. I'm going to be spending next week over at San Diego Sexual Medicine with Dr. Erwin Goldstein and his staff, and I am going to learn a lot more about sexual dysfunction conditions and how to address them, and pelvic pain and pain with intercourse, and I'm just ready to sort of absorb and be a sponge next week and learn for, so I can better help our community and our patients, and I can't wait to come back and share.
Oh my gosh. So we'll have to come back with that, and then maybe we'll do a couple more of these.
That sounds
great. And then
great.
we got to figure out like a fun way to say bye to everybody. But for now, thanks for joining us.
Thank you.
Bye.